The problem we have today, I think you know, most everyone here has experienced, there's very little time when you go to see a doctor. They don't have all the data, they don't have time to review it all. In fact, even if they could review it all, it's only the data from that particular health system. So we have incomplete data, incomplete context, insufficient time, and that we have the state of shallow medicine. The idea that technology has negative consequences is real, but we're kind of in a desperate situation right now in healthcare. So my biggest fear, I have concerns about the privacy and security, obviously. Things like the bias that's embedded, it's mainly human bias into algorithms. Things like worsening inequities, which we already have serious problems. Lots of those problems that are front and center. But to me, the biggest issue is that if we don't get this right, that is the gift of time, all these efficiencies, accuracies, productivity, ability to process information for both patients and doctors at a speed and completeness that never was conceived before. What will happen is, if we don't stand up for patients now, the administrators, the managers who have nothing to do with patient care, they're just the bean counters, they will make things worse. They will make the squeeze continue. And we will see even further attrition. So this is the time where we have to say, this opportunity is not likely to represent itself for generations, if ever. So I do agree that overall there is a hit of technology, but here we have dehumanized healthcare. We have gutted the care of healthcare. This is our only shot to get it back that I know of.
Welcome to FutureScape. My name is Kirthi Roberts, and I'm the producer of the show, where we discuss innovations, possibilities, and probable realities, seemingly good or bad, of the future today. As you saw in the opening clip, we have an exciting episode today, one that showcases the potential of artificial intelligence to revolutionize healthcare and bring back the human touch and the gift of time between doctors and patients. Join me as we explore the captivating journey of Dr. Eric Topol and his groundbreaking book, Deep Medicine: How AI Can Make Healthcare Human Again. Dr. Eric Topol, a renowned cardiologist, takes us on a profound journey through the complex world of healthcare and artificial intelligence, and reveals the shortcomings of our current healthcare system and how AI holds the key to making it human again.
The story of the book begins with my knee. I underwent 3 years ago a total knee replacement because of a congenital condition, a rare condition called osteochondritis dissecans. And I specifically lined it up to go to the orthopedist that I had sent all my patients to because they all had very good results. And in fact, the operation itself was a great success. It was just afterwards that it was a disaster. And I went to see the orthopedist a month post-op. And then my leg was swollen. It looked like I had gangrene. It was just, I had been in horrible pain, couldn't sleep, but for minutes or an hour at a time, and I'd been having crying spells, and I really, it was in desperate shape. And he looked at me and he said, "I think you need to get antidepressant medications." And that was kind of a robotic response. And the other part of this, the layers of this are that had he used AI, he would have had all my data and would have told him, this guy Topol has osteochondritis and he's going to have a really bad arthrofibrosis reaction. And I've got to do special things so he doesn't get that. Because that's more common than an infection, which is the dreaded one, which he told me about before the operation. It happens twice as often, and it's this scarring. It's basically a kind of reaction to this artificial knee. It's like a major inflammation in all the scarring. So I had that, and I actually have never fully recovered. But it's the problem we have today, David, is, I think most everyone here has experienced, there's very little time when you go to see a doctor. They don't have all the data, they don't have time to review it all. In fact, even if they could review it all, that's only the data from that particular health system or that area. So we have incomplete data, incomplete context, insufficient time, and that we have the state of shallow medicine.
He takes us through the journey of time and describes the doctor-patient relationship going back several decades, the transformation into the business of healthcare, the problems of electronic health records, the burnout among physicians, and the overall degradation of healthcare.
I finished medical school in '79, and prior to that time, when the relationship with the doctor was precious. There was trust, there was presence, there was lots of time, there was a human bond. And what happened around early 80s, many different factors took hold, but essentially it became a big business. And things happened like the relative value units, which basically really diminished the value of the interaction, but increased the value of things like operations and procedures. And then the latest hit in the 90s was the electronic health record, which converted doctors and nurses and all clinicians to data clerks. And that has basically led to this remarkable despiriting, a disenchantment level we've never seen, with more than half of clinicians suffering burnout, 20% clinically depressed, the highest rate of suicides ever among doctors in history of the profession. So we have seen a lot of degradation. And the main problem with the time, it's not just the patients feel shortchanged, the doctors can't fulfill their mission. Why did anybody go into healthcare to look after patients if they can't look after patients and provide care? So that's kind of the state that we're in right now, unfortunately. I think that's why we have to look at technology, not with a blind eye by any means, but to take the things that it can do to give us this gift of time, which is the beginning of the restoration, the beginning of reestablishing trust and presence and a relationship. Because the patient-doctor relationship is almost non-existent. Some of you may have that, but most people are roughed up when they go to a doctor today because they feel like, hey, I didn't even get examined, or I had just a few minutes, I never even saw the doctor's face. They were pecking on a keyboard. That's kind of the problem we have today. The first thing that we could do, which is already being done in the UK and select centers and in many centers throughout China, is to liberate from keyboards. Keyboards are the common enemy of patients and doctors. And now with natural language processing, which is a subtype of AI, different than deep learning, but it's a lot of the same principles. We're already at a point where that can be done. It's just a matter of rolling it out. And there are select places it's being piloted here in this country. If we can get rid of data clerk functions for doctors, that frees up a tremendous amount of time. Also, it restores the face-to-face contact. So we have to think of the ways that we can do this that are, keyboard liberation is about voice processing, and you get much better notes, synthesized notes from that conversation than you get from the cut and pasted notes that are in your electronic records, which are 80% of the notes are cut and pasted, and most of them have significant errors that are propagated from one note to the next. So these are things that cut across all health encounters, not just people who are happy with their care, but for everyone.
We've identified the challenges with healthcare today, so how can AI help improve medical and patient outcomes? And what are some areas of applications?
One thing about radiologists that most people don't know is that over 30% of scans have a false negative. That is, something is missed. So that can get down to low single digits, never get down to zero, but maybe in the 1 or 2% with the use of training machines. So radiologists have had a big benefit. They will derive quite a bit of augmented intelligence, if you will. But also we've seen a big jump in other fields, especially noteworthy is in gastroenterology. So having a colonoscopy is not many people's favorite thing to do, and it's even worse if they miss something, and it's common. Small polyps, diminutive polyps, which can be precancerous just as much as big polyps, can be missed. And a randomized trial showed that missing them by machine vision AI, deep learning, can be brought down to almost zero, which is great. And then another area that's had a lot of, perhaps the most rigorous work is in eye diseases. The ability to diagnose diabetes retinopathy, which is frequently missed, which now can be done by the receptionist, doesn't even require a doctor at all. And also things like many other conditions like macular degeneration. And so eye diseases are going through revolution using deep learning.
Further confirming Dr. Topol's point, here's a recent article about the launch of the Center for Ophthalmic Artificial Intelligence and Human Health at the Icahn School of Medicine at Mount Sinai Hospital in New York, a first of its kind in the United States. The stated mission is to lead the way in incorporating AI into trainee and physician education, and the clinical setting for rapid diagnosis of eye diseases and conditions across macular degeneration, diabetic retinopathy, glaucoma, hypertensive retinopathy, and retinal tumors. As early detection and intervention can prevent vision loss and may also prevent heart attack and stroke,
since a number of eye conditions are linked to cardiovascular and neurological issues. There are also a growing number of non-serious medical issues where deep learning can safely and conveniently empower and assist the patients, doctorless.
There are certain things like patients can now get, if you're in the UK or other countries, you can get your urinary tract infection diagnosed with deep learning very inexpensively, going just to the drugstore to get the kit. You can get your child's ear infection diagnosed, a skin rash diagnosed. So the list is increasing quickly, doctorless. But these are non-serious, not the kinds of things that you have to rely on a doctor. In fact, you can get them done more accurately without a doctor, quicker and less expensive. So we'll see these things develop for consumers, patients, but all these serious matters are going to require doctors. So we're not going to go doctorless, only in special non-serious circumstances.
At a recent biotech summit in San Francisco, Sun Microsystems co-founder and billionaire venture capital investor Vinod Khosla seems to think otherwise. And here's an interesting real-world deep learning and AI application in the area of mental health, shared by an audience member, and the resulting discussion with Dr. Topol.
But I wanted to get your feedback on, I think, an organization that's using keyboards quite effectively. I don't know if you're familiar with Crisis Text Line. This is a mental health crisis line that uses text interaction as opposed to getting on the phone with a counselor, although you are live with a crisis counselor. But they are a pioneer in using deep learning to better connect people with services on their platform. For example, like they programmed their platform with certain words that they thought would be indicative of a suicide attempt, like die, suicide, etc. And what they actually found was that the word ibuprofen was 14 times more likely to predict a suicide attempt. So these are places where we can use machine learning to actually better inform people who may be very empathetic, but would probably miss something like that because it seems sort of counterintuitive. But on a disintermediated sort of interaction platform, I think they're just an example of somebody who's really doing this combination of machine learning and human intervention in a really good way, and I'd love to get your feedback.
I think I referenced it in the chapter on mental health in the book, what you're doing. The point is a great one, and that is within text, not just speech, there are cues that we wouldn't know, just like you're pointing out with the ibuprofen, that actually are indicators of suicidal ideation. So this is really important, is that, and it really summarizes the whole opportunity here, that machines can be trained to see things, learn things that we can never do. Who would have ever thought that was going to be the signal, right? And this is, I think, really important because predicting suicide, psychologists and psychiatrists are not very good at this at all. You know, I review that data in the chapter. But we can actually get help from deep learning to find the cues that we should be zooming in on. Yeah.
I really like this following exchange with a cancer survivor. We will regroup on the other side of it.
I'm Bruce McEver. I'm a cancer survivor. And as a cancer survivor, I've been sequenced, I've been x-rayed, I've been CAT scanned, I've got all the information that could possibly has been gathered from me. And yet every time I go to the doctor, I spend the first half hour filling out from 2 to 4 to 6 pages of information. Why isn't that traveling with me? And why isn't it traveling with everyone in this room?
Yeah.
After a while, you've got it all, the information. They don't need any more information.
Right.
And you know why? What is no matter, regardless of where you go, even in this hospital where I got my surgery, they want to get another X-ray. I've got to have fill out all these pages of information.
Yeah.
So
I'm glad you mentioned this, and it's so true. It's so real that you have to just fill out the same forms all the time. And this is kind of that shallow medicine that we have today, right? So I've made the case that everyone should own all their data. It's your data, you paid for it, and you have a vested interest, and it could even save your life. One of the things that people don't know, which is remarkable, is that 10% of scans in this country, we're talking about billions and billions of dollars, are repeated unnecessarily because the patient can't get a hold of their scan. So they just have to, we'll have to just do it again. And those are really expensive, by the way. So if you had all your data, and you wouldn't be filling out all these forms because you would just send that data, here's my baseline, boom, and you would just give it. In Estonia, of all places, that's the way it works, right? And other countries like Finland, Sweden, Switzerland, that's how it works. But in this country, we still have these forms with the clipboard. We can do better than this. That doesn't even require artificial intelligence. That just requires human endeavor to make it better.
The key takeaway from this exchange is that whether you're a medical practitioner, patient, hospital administrator, or a government ministry responsible for patient healthcare, artificial intelligence is by no means the be-all and end-all. And while there is no doubt there is much we can do to improve patient healthcare outcomes by incorporating AI and deep learning technologies into healthcare delivery as appropriate, as we've discussed in this video, there is much we can do today to improve patient outcomes that does not require AI, but good old human intelligence and ingenuity. If you're interested in other examples and applications of AI in healthcare and medicine, I would encourage you to dive deeper into Dr. Topol's book, Deep Medicine, which I shared earlier. Another recent and fascinating book I am presently reading, which I will do a separate video on in the coming weeks, and I would also recommend on this topic, is The AI Revolution in Medicine, which is sort of a collaboration by key personnel from Microsoft and Harvard Medical School. If you enjoyed this video, give it a thumbs up and share it with others who might find it fascinating. If you agree or disagree with the views of anyone in the video or have a question, I would love to hear from you. Make sure to check out our next video on another exciting topic related to technology, innovation, and promising future possibilities for all of us. Until then, stay curious, stay informed, keep pushing the boundaries of what's possible, and see you in the next video.